Okay, everyone ready? All right, let's go. Now, our first stop this morning is going to be in the ED, and this has become the entry point for most COVID patients into the hospital.
We have 46 beds in this department. On a good day, I could run 56 maybe if I use every hallway and nook and cranny. And last week I had 125 people in this department. Most of them COVID, all of them unvaccinated.
But because we're running 2 hospitals now, one hospital is an infectious disease hospital, and then the second hospital is the normal med-surg hospital.
We are as full as we can be. We are taking care of as many patients as we can. So when you think about your grandmother or your mother or your sister, that could have something else that happens. Let's say they get in a car accident or have a stroke or have a heart attack. You want to make sure that there's enough room to be able to take care of those patients as well, not just the COVID patients.
Tell us what it's been like for you to be going through this COVID for the past year and a half.
Well, it's very frustrating as a nurse, and you thought, last December when we all got vaccinated, that was very, hopeful. The amount of people we've had coming in that have not been vaccinated is very, very frustrating because that's a choice at that point.
An overwhelming amount of volume coming in.
It's way worse than last year.
Much younger, much sicker, much quicker.
As a veteran, I've served in Iraq and Afghanistan, and I've seen what it can do to people, and I'm worried because a lot of my nurses are having to deal with death on a daily basis, and that's not normal.
We've lost a lot of nurses in this profession just simply because of the fact that they're tired, they're physically tired, and they're emotionally tired.
The death and having to tell family members.
You hear them gasping for air and begging for help and saying, "I can't breathe." So the public needs to know that it's a serious thing. They need to wear their masks, they need to wash their hands, they need to look out for each other and be there.
When we do know that they are going to pass, we always make sure that somebody is with them at the bedside and we hold their hands.
One of the caregivers is there, so they're not.
So they don't pass alone.
Although we talk about 650,000 deaths, it's made up of moms and dads and individual people, and each one of those persons is not a statistic, they're a human being.
It's sad. It is a hideous waste of a body and a human being and the sanctity of life.
It's heartbreaking to watch, and especially families. You're seeing kids being orphaned.
They're not getting vaccinated because they're pregnant, and it's really sad because while they're up there sick, they can't have their parents because their parents are also sick. And what about that child that the parents don't come home from the ICU?
We've seen more positive COVID patients, symptomatic COVID patients in the last 2 months than we did in the last year and a half, total. Babies can't protect themselves. It's our job to protect them.
The first round, there were a lot of older populations, but now we're seeing 30-year-olds, 40-year-olds, 50-year-olds coming in, and they're sick as ever. And most of the time, they don't make it out.
I feel bad for them because they are struggling, but it is preventable.
How are you all holding up? How do you keep each other from holding up?
That's kind of what we signed up for, take every day as it comes, and try to treat people like our family.
When we walk in the door, that's on our mind. What can I do to be of service to someone this day?
They strive to give that hope, and they're here to help. And you can see it in everybody's face here. All they want to do is help.
Get the vaccine. It's safe. It's scientifically sound. It's been studied. It's been researched.
Get your shot. It's not that complicated.
Get vaccinated, please.
Get vaccinated. That's the best thing you can do for you and your child and your family.
I hope they trust us enough to think about getting the vaccine.